Hey there, welcome to Health with Samantha DPT. I'm Samantha Holland, Doctor of Physical Therapy, and this video is talking about diaphragmatic breathing. So let's start with what is the diaphragm. The diaphragm is a really important muscle that sits right under your rib cage. It separates your thoracic cavity or your chest from your abdominal cavity. So the main purpose of the diaphragm is to help with breathing or help you inhale. It is innervated by the phrenic nerve, has a lot of other connections and important functions. But when it contracts, it flattens and increases the space in your thoracic cavity, and the alternate air pressure allows air to enter in your lungs. So why are we talking about this? Well, over time, or just for whatever reason, whether it be disease or compensations, your secondary muscles of breathing can start to become overactive and your diaphragm becomes less active. So the secondary muscles include the upper traps, the sternocleidomastoid, other muscles of the upper cavity, your neck and shoulders, and even of the upper back. And they start to overpower the activity of your diaphragm. So sometimes it's important to just check in on how you are breathing. And the reason I talk about the secondary muscles is if they're overactive and are contracting too much, this can lead to issues such as headaches or other myofascial pain that is already common in this region due to stress. So adding overactivity isn't necessarily a healthy thing. But diaphragmatic breathing has a lot of benefits just in grounding yourself. It helps with anxiety, just bringing airflow back to the area that's intended to be, brings a lot of great function to the abdominal cavity, the thoracic cavity, helps expand the rib cage. So today I'm going to be showing you how you can practice diaphragmatic breathing at home. So in a second here, I'm going to get on the mat behind me, and what I'm going to do is I'm going to put one hand on my chest and one hand on the diaphragm. And I think a lot of other videos maybe show a hand on the stomach for more belly breathing, which is great if you're having a hard time figuring out how to activate your diaphragm. However, I prefer more on the upper belly, just below the bottom, or just the lower ribs, right below the rib cage, because that's where your diaphragm really sits and that's where you can feel it contracting and expanding. Okay, so really what you're gonna do is be taking deep breaths in through your nose, keeping your face relaxed, and just having your hands in these two areas, and you're trying to feel just the lower hand move so that you're avoiding too much chest expansion if you're really trying to focus on purely diaphragmatic breathing. All right, so I'm gonna come back here. All right, so you lay flat in a comfortable space. Like I said, one hand on the chest, one hand on the upper abdomen, and you're gonna take a deep breath, and you should only feel the hand on the lower abdomen or the diaphragm move. All right, so you can try this at home, and sometimes it's difficult to figure out at first how to get just the lower hand to move if you're really used to your upper chest expanding. I tend to tell people to breathe in through the nose and out through the nose just because that's normal breathing in your everyday life, so it's a good way to practice adding the diaphragm in with the normal breathing. You can also put your hands on your ribs. I'll show you up here. And so you can feel for more rib expansion and kind of cue yourself while you're taking your deep breaths of how you feel your ribs flare out a little bit more to get more expansion in this area as you're practicing your diaphragmatic breathing. Don't be surprised if at first when you're trying this you feel a little bit lightheaded because you're taking deeper breaths. So you can overdo it, be careful with that. I'd recommend maybe reps of about 10 diaphragmatic breaths at a time. You can practice this daily. You can especially practice this during times of stress, or you feel like you're getting anxious, or you start to feel your shoulders creep up towards your ears. That's a good time to step away, check in, maybe lay down, do about 10 diaphragmatic breaths nice and slow, and reset yourself. All right, and then progressing this, you can start focusing in on your breathing while you're doing physical activity, running, exercising, just making sure that you are engaging that diaphragm as you're doing activity to avoid overactivation of other muscles. All right, I hope you enjoyed this video. Please subscribe for more videos like this, and feel free to comment if you have any questions. Thank you.